Hello, everyone, and welcome to Connecting the Dots with Dr. Ashaye. It's a great place to be if you desire to take charge of your health and make sure that you live fully while enjoying what you love. So we're in the last week of the year already, and many of us are looking ahead. We're preparing for the new year. And the truth is, to accomplish the goals and the dreams that we have ahead, we need to make sure that we become or we stay healthy. So today I'm going to be talking about how you can do that. Our topic is health screenings. And screening means that we're checking for a condition when there are no symptoms at all. So the reason we do this is because many serious health conditions, unfortunately, do not cause any symptoms until later in the course of the disease when it's so much harder to treat. So by checking for it and catching it early, you can save significant time, a lot of money, and even in some instances, save lives. So screening is really, really important. And today I'm just going to talk about the different screening tests. So you can get a list of a sheet of paper and see what tests that you've done and see which ones that you might need and make sure that you're up to date. But before we get into it, you are listening to Connecting the Dots with Dr. Ashaye. I'm your host, Lola Ashaye. I'm a family medicine and lifestyle medicine doctor and owner of In Touch Primary Care, a membership clinic in Sugar Land, Texas. And I'm so excited you're here. If you're seeking a much more convenient and proactive approach to your healthcare, come and join us. You can enroll at www.intouchprimarycare.com. So remember, you can always listen to this episode and all our other episodes on the In Touch Primary Care YouTube channel. Leave comments, subscribe, and please share with someone that might need it. You never know. It could make a huge difference for them. So let's get into it. We're talking about health screenings. And as I mentioned, screening for health conditions mean that we're checking for a condition when the person has no symptoms. It means you feel 100% fine. Nothing is wrong with you. You don't have a headache. Your stomach doesn't hurt. You feel perfectly fine, but we're still doing tests to check to make sure that you are actually fine. And a key point I want to make today is that feeling fine does not equal being fine. I've seen many scenarios where the person looked fine, the person felt fine, and they were not fine. So I've told the story of a patient I had in the past who came in for blood pressure, young person in his 30s, and was doing his heart exam, and all of a sudden noticed that his heart rate was irregular, and turned out that he was in a irregular, dangerous heartbeat, atrial fibrillation. And we had to get him to start medication that evening. He had to see the cardiologist the next day. So that kind of irregular heartbeat could have led to a clot, which could have caused a stroke. So he felt fine, he looked fine, but when we did a physical exam, he wasn't fine. I've also had other scenarios where a patient feels fine and we did their lab tests and their cholesterol levels were very high. High cholesterol leads to heart disease and strokes, or people that felt fine and turned out that they had full-blown diabetes, or people that felt fine and their blood pressure was 170 something over 90 something, and that's like a stroke or heart attack waiting to happen. So feeling fine doesn't equal being fine, and I really want to make sure that as many people understand that as possible so that you can be more proactive about your health. So, okay, what are conditions that we can check for or that we check for during your checkup? And the truth is we cannot screen for everything, but we can screen for many things, many things, and many serious things that can be prevented when we catch them early. So the way I think about it is in categories. So the first category is heart disease, and that's because it's the most common serious health condition and the number one cause of death, heart disease. So this is how do we screen for it? Typically, we measure different risk factors to check your heart. So that includes your blood pressure, your weight. Then we screen with blood for diabetes and high cholesterol. So those are the things that we would check for when we're trying to determine if a person is at risk for heart disease. So we take all those values together, and then we determine based on all of this whether or not what your risk is, and that will help us determine what to treat, if anything. Other things that we'll take into consideration will be things that we talk about, like, do you smoke? Are you physically active? Do you have a family history of heart disease? So all those things will also come into play when we take a look at your blood pressure, weight, your blood work for diabetes and cholesterol. So that's a simple, just a simple evaluation for heart disease. Obviously, we're also going to be listening to your heart and your lungs and doing a full exam, and that will help us further determine whether or not you have risks for heart disease after talking to you and measuring these different objective things: your blood pressure, your weight, diabetes screen, cholesterol screen, but also talking to you about your history, doing a physical exam, and making sure that you don't have any risks for heart disease. Okay. The next category, that the way I think about it, is cancer screening. So, to go back to heart disease, that should start for every adult. So starting at age 18, you should be screened for heart disease. How frequently you screen depends on the results. So if you have a family history, we may screen you more often. If your blood pressure was high, you may be screened more often. It just depends on the values, what we got the first time we screened. If everything was normal, completely normal, then screening might be every 3 to 5 years, depending on the person. But most people will need to be screened yearly for heart disease. So that's that. Now, for the next category, cancer, that starts at age 21 with cervical cancer screening for women. And that's with a pap smear. So cervical cancer screening starts at age 21 for women, and continues with breast cancer screening and prostate cancer in some cases for men. So breast cancer screening for women starts at age 40. The discussion starts between age 40 and 45, depending on the man. And then colon cancer screening now is recommended starting at age 45. So cancer screening starting at age 21, going all the way up to 45, or obviously beyond, depending on how often what was found, and how often will depend on what was found and all the other risk factors that people will have. So those are the types of cancers that we typically will screen for, which means that you don't have any symptoms at all, but we're checking for them anyway because they're very common and because there's a way to treat them to prevent them from becoming worse. Okay, the next category of screening is for sexually transmitted infections. So things like HIV, hepatitis, syphilis, gonorrhea, chlamydia, and that screening is done for people that are sexually active or people that might be at risk for because they're in contact with blood or other human substances. So that's the next category of screening. So again, usually that's with the blood or urine, and it can be done during your physical exam as well, or your annual physical. And again, a physical exam will be done to make sure that all those things are fine. Now, there are other screening tests, right? So we talked about the big categories, which are heart disease, cancer, and then sexually transmitted infections. But there are other categories, like there's bone density screening, which is usually done for people that are older, to make sure that if they do fall, they don't break a hip or break some of their spine, which can be a big problem. There's screening for anemia. There's screening for thyroid disease. There's vitamin deficiency screening for mental conditions like diabetes, like depression and anxiety. And obviously, there's doing your eye exam. Very important to screen for glaucoma and also to see a dentist. So there are many different things to screen for during your physical And these, here is a list of the things. So heart disease, cancer, sexually transmitted infections, and then the other things we screen for depending on other risk factors. And there are other kind of cancers too that we will screen for depending on risk factors as well. Okay, so again, screening for health conditions means we're checking for a condition when there are no symptoms. It means you feel fine, but we check because many serious health conditions do not cause symptoms until later in the course of the disease. And the longer you wait, the more complicated, the more expensive, and unfortunately, the more pain or discomfort that people feel when the disease has progressed. So please take it seriously. And if you're in the Houston area, and you're looking for a doctor that is proactive about your health, check us out at In Touch Primary Care. If you want to get to know us first, you can schedule a one-time detailed evaluation by selecting a per visit visitor consultation. So you can select a per visitor appointment, and you can schedule a one-time detailed evaluation so that you can get your checkup done. So find out more about this on our website, www.intouchprimarycare.com. As you know, we do not process, we're out of network, so whether or not you have insurance is not an issue for us. Your health is too important to rush, too important to ignore. You need your health to enjoy doing what you love. So prioritize it today. And if you know anyone that needs this, please share this episode with them. Thanks for watching, and see you next week, Wednesday at 2:15 p.m. Thank you.